Welcome to 650's Cal OSHA Emergency Temporary Standards Training. This training has been updated to include revisions to the emergency temporary standards that took effect on January 14th, 2022. This training should last for approximately 30 minutes. The California Division of Occupational Safety and Health, better known as Cal OSHA, issued Emergency Temporary Standards, or ETS, to protect workers in California from COVID-19. The ETS have been updated several times, including revisions that took effect on January 14th, 2022. The ETS require employers to train employees on different topics related to COVID-19 prevention, and this video is intended to fulfill that training requirement. In today's training, we will cover your company's COVID-19 policies, information about COVID-19, ways to protect against COVID-19, including wearing masks and respirators, washing hands, and getting vaccinated. We will also cover testing for COVID-19 and what to do if you get COVID-19. The Emergency Temporary Standards require California businesses to create a written COVID-19 prevention program, or CPP, that includes COVID-19 policies and procedures, an identification and evaluation of COVID-19 hazards in the workplace, and a system for communicating COVID-19 information to employees, including a process for employees to ask questions or express concerns about COVID-19 policies or COVID-19 hazards. You should feel free to ask your employer for a copy of its CPP or to ask how you can ask questions or express concerns about COVID-19 policies or COVID-19 procedures. Remember, your company may update its CPP as circumstances change and will alert you to changes in its CPP. In this training, we will cover what is required by Cal OSHA's Emergency Temporary Standards. Your company may adopt policies that are more protective than those required by the Emergency Temporary Standards and will inform you of its company-specific policies.
Before we get into the details of this training, it's helpful to first take a step back and define what is COVID-19. COVID-19 is a respiratory disease caused by SARS-CoV-2, a new coronavirus discovered in 2019. COVID-19 is an infectious disease. How does COVID-19 spread? Well, COVID-19 spreads when an infected person breathes out small droplets and very small particles that contain the virus. These droplets and particles can be breathed in by other people or land on their eyes, nose, or mouth. In some circumstances, they may contaminate surfaces they touch. People who are closer than 6 feet from the infected person are most likely to get infected. Particles containing the virus can travel more than 6 feet, especially indoors. COVID-19 is spread in three main ways. First, it can be spread by breathing in air when close to an infected person who is exhaling or talking and emits small droplets and particles that contain the virus. Second, COVID-19 can be spread by having these small droplets and particles that contain the virus land on the eyes, nose, or mouth of another person, especially through splashes or sprays like from a cough or sneeze. And finally, COVID-19 can be spread by touching contaminated objects, then touching one's eyes, nose, or mouth with hands that have the virus on them, although this method of spread is the least common. There are several different ways to prevent the spread of COVID-19. These preventative measures can decrease the spread of COVID-19 individually, but are most effective when used in combination. These preventative measures include, first, vaccination. Getting vaccinated and staying up to date on vaccines are effective at preventing COVID-19 and highly effective at preventing severe illness, hospitalizations, or death for persons who contract COVID-19. Second, physical distancing. The CDC recommends staying at least 6 feet away from other people, especially for persons who are at higher risk for getting sick with COVID-19. Third, face coverings can be particularly effective, and we'll talk more about those in this training. Increased ventilation indoors and avoiding poorly ventilated spaces and crowds can also decrease the spread of COVID-19. This can be done by opening doors and windows if possible to bring in fresh air and avoiding indoor spaces that do not have fresh air from the outside. Respiratory protection can also be useful in preventing the spread of COVID-19. Frequent hand washing is helpful, and we'll talk more about that in this training, as well as covering coughs and sneezes. If a person is wearing a mask, they should cough or sneeze into the mask and then put on a new mask as soon as possible and wash their hands. For persons who are not wearing a mask, they should always cover their mouth and nose with a tissue when they cough, sneeze, or use the inside of their elbow, and immediately wash their hands afterwards. Cleaning and disinfection can also prevent the spread of COVID-19. Cleaning high-touch surfaces regularly or as needed, especially after having visitors, can decrease the spread of COVID-19. High-touch surfaces include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, and other items. If someone is sick or has tested positive for COVID-19, they should disinfect those surfaces touched by the person who had COVID-19. Also, monitoring daily health can prevent the spread of COVID-19. This means being alert for symptoms. Monitoring symptoms is especially important if a person is running errands, going into the office or workplace, or in settings where it's difficult to maintain social distancing. Testing to prevent the spread of COVID-19 to others is especially helpful. There are many different types of COVID-19 tests. Viral tests are tests for SARS-CoV-2, the virus that causes COVID-19, and they tell if a person has an infection at the time of the test. Over-the-counter self-tests are viral tests that can be used at home or anywhere. They're easy to use and produce rapid results. Anyone can use self-tests, regardless of their vaccination or status or whether they have symptoms. Regardless of the test selected, a positive result means that person has an infection and should isolate, and we'll talk more about that later in this training. Also, individuals should follow recommendations for quarantine and isolation if they have COVID-19 and take precautions when traveling by following CDC guidance.
Let's transition to talk about face coverings and what the ETS requires in terms of face coverings. So your employer will provide face coverings to employees who are not fully vaccinated or to all employees when required by an order from the California Department of Public Health or upon request. And the face covering that the employer provides will be clean and undamaged. So what is a face covering? How does the ETS define face covering? Well, it has a pretty specific definition and specific requirements there. So you can't just, for example, take a newspaper and put it over your face and call it face covering. That wouldn't work. So face covering means a surgical mask, a medical procedure mask, a respirator worn voluntarily, or a tightly woven fabric or non-woven material of at least 2 layers. 2 layers means that no light passes through it when it's held up to a light, but it's important to note that under the ETS, clear face coverings that let light through, which are designed to facilitate communications with people who are deaf or hard of hearing, are okay, so long as they otherwise meet the definition of face covering. A face covering is a solid piece of material without slits, holes, or punctures that completely covers the nose and mouth. It has to snugly fit over the nose, mouth, and chin and have no large gaps on the outside of the face. It must be secured to the head with ties, ear loops, or elastic bands that go behind the head. Importantly, a face covering doesn't include a scarf, a ski mask, a balaclava, a bandana, turtleneck, collar, or single layer of fabric. The ETS does permit gaiters to be worn, but they have to have at least 2 layers of fabric or be folded in half to make 2 layers. And it's also important to note that face shields are not replacements for face coverings, but they may be worn in combination for extra protection. So when do face coverings need to be worn under the ETS? So remember here we're covering the minimum ETS requirements, and your employer might have a more strict requirement about face coverings, and if that's the case, your employer will communicate that policy to you. It's also important to note that the ETS won't displace state or county orders that impose more strict requirements, and so your employer will also let you know if those types of state or local orders apply to your workplace. So under the ETS, until very recently, actually, anyone that was not fully vaccinated was required to wear face coverings when indoors and in vehicles. But by an executive order of the governor very recently on February 28th, 2022, the governor said in that order that the ETS's requirement that all employees not fully vaccinated must wear face coverings when indoors and in vehicles will no longer be enforced. But it continues to be very strongly recommended that unvaccinated employees in these settings wear face coverings. Under the ETS, face coverings still need to be worn when required by an order of the Department of Public Health. And if that's the case, again, your employer will communicate that to you. Generally, employees are not required to wear face coverings when outside, but face coverings are recommended when employees can't keep 6 feet of distance from others. Also, certain employees who are permitted to return to work after a close contact must wear a face covering at work for 14 days following the date of the last close contact. And then finally, any employee can request a face covering from the employer at no cost and can wear it at work regardless of vaccination status without any fear of retaliation. So face coverings are not required when an employee is alone in a room or vehicle, or while eating or drinking at the workplace, provided that employees are at least 6 feet apart and outside air supply to the area if indoors has been maximized to the extent feasible. Face coverings also aren't required if the employee is wearing a respirator required by the employer, and we'll talk in a minute about the difference between simple face coverings and respirators. Face coverings aren't required for employees who cannot wear face coverings due to medical or mental health conditions or disabilities, or who are hearing impaired or communicating with a hearing impaired person. Finally, they're not required when performing specific tasks, which cannot feasibly be performed with a face covering. But this exception is limited to that time period when those tasks are actually being performed. So some big takeaways from what we've talked about so far in terms of face coverings. Employees can request face coverings from the employer at no cost to the employee and wear face coverings at work regardless of vaccination status without any fear of retaliation. So I mentioned before a difference between simple face coverings and respirators. So let's talk about that now. A respirator is a specific type of face covering that protects the wearer from particulate matter by filtering out contaminants from the air. For example, you've probably heard of an N95 mask. That is an example of a respirator. Now, not all face coverings are respirators, so we talked about a lot of simple face coverings on a previous slide, like surgical masks. So a surgical mask is not a respirator because it doesn't filter contaminants from the air. The takeaway here is that simple face coverings are not respiratory protective equipment. Respirators provide a much greater level of protection than basic face coverings, and that's because they protect users from airborne diseases like COVID-19, while simple face coverings primarily protect people around the user. So let's talk about respirator policies in the workplace and what the ETS requires. Under the ETS, employees have a right to request a respirator from the employer at no cost to the employee if the employee is unvaccinated and working indoors or in vehicles with more than one person, or if they're unvaccinated and the workplace experiences a COVID-19 outbreak. If there is a COVID-19 outbreak at your work, your employer will give employees in the exposed group notice of their right to request a respirator for voluntary use if they're not fully vaccinated. If there is a major COVID-19 outbreak at work, your employer will provide respirators to all employees in this exposed group for voluntary use, regardless of vaccination status, and there's no need to request a respirator in that circumstance. Now, I've used a lot of terms like outbreak and major outbreak and exposed group. The ETS has specific definition for all those words, so let's just briefly talk about how the ETS defines these terms. So exposed group means essentially just means all employees in the same work area as another employee with COVID-19. An outbreak means that there are 3 or more cases within an exposed group that visited the workplace during their high-risk exposure period at any time during a 14-day period. High-risk exposure period is also a defined term under the ETS, and Marie in the next section is going to go into more detail about exactly what that means. Major outbreak means that there are 20 or more COVID cases in an exposed group that visited the workplace during their high-risk exposure period within a 30-day period. A couple final notes on respirator policies. So It's important to keep in mind that respirator use is voluntary. It's not required that the employee use the respirator, even if they've been given it or requested it from the employer. And then also your employer cannot retaliate against you for requesting a respirator. In situations where you do have to request a respirator, your employer's CPP will provide you additional information on who to contact if you would like to request a respirator. And then finally, there's nothing that prohibits you from wearing your own respirator in the workplace whenever you want, regardless of your vaccination status. Let's talk now about how to properly use a respirator. So when your employer provides your respirator, it will be the correct size for you and the correct fit. Once you have it, it's really important to know how to properly put it on and how to perform a seal check. It's also important to know that facial hair can interfere with creating a proper seal. So let's watch this short video about how to properly put on a respirator and perform a seal check.
When wearing a mask for work, the following steps can help you correctly put it on and take it off to keep yourself and others safe. First, wash your hands thoroughly and inspect your mask. If it appears damaged, do not use it. After inspecting the mask, cup it in your hand with the nose piece at your fingertips and the straps hanging below your hand. Next, lift the mask under your chin with the nose piece up. The top strap should go over and rest at the top back of your head. If you have a second strap, position the bottom strap around your neck and below your ears. Be sure not to crisscross the straps. If your mask has a metal nose clip, place your fingertips from both hands at the top of the clip. Slide your fingertips down the sides of the metal strip to mold the nose area to the shape of your nose. Now you need to check for a proper seal. Place both hands over the mask and take a quick breath in to check whether the respirator seals tightly to your face. Keep both hands completely over the respirator and exhale. If you feel leakage, there is not a proper seal. If air leaks around your nose, you need to readjust the nose piece. If air leaks at the mask edges, readjust the straps along the sides of your head. Take these steps until you get a proper seal. If you do not have a proper seal after repeating the steps, ask for help or try a different mask. Once your mask is on with a proper seal, do not touch it. Before removing the mask, first thoroughly wash your hands, then reach up and pull the strap over the back of your head without touching the respirator. If your mask has two straps, remove the bottom strap first, followed by the top strap. Discard the mask in a waste container and again thoroughly wash your hands. Following these simple steps will help you properly put on and take off your mask and keep you and everyone else safe.
All right, one note about that very riveting video is that the narrator refers to the respirator as a mask, but I just want you to keep in mind the important differences we talked about between simple face coverings like masks and respirators, which are provide a greater level of protection like we talked about before. Also, your employer is going to provide you with additional information about the specific manufacturer's instructions for performing a seal check. All right, that's all for masks. Let's talk very briefly about hand washing. So 2 years into the pandemic, I'm sure you have had your fill of hand washing tips and tricks, but just a little bit of quick information about hand washing. So one important way to stay healthy is to wash your hands frequently with soap and water for at least 20 seconds. I'm sure you've probably heard that to measure the 20 seconds, you can sing Happy Birthday twice. If you're tired of singing Happy Birthday twice, some other recommendations, you can sing the chorus of Jolene by Dolly Parton twice, Truth Hurts by Lizzo, No Scrubs by TLC, or Landslide by Fleetwood Mac. So if you're washing your hands at work, make sure to belt out your song of choice so that your coworkers can enjoy it as you're washing your hands. It's important to know that hand sanitizer can also be a helpful way to keep your hands clean when you don't have access to a sink or hand washing facility, but remember that hand sanitizer doesn't work if your hands are soiled. Okay, with that, I'm going to turn the time over to Marie to talk about COVID vaccines and what to do if you're experiencing COVID-19 symptoms or have tested positive for COVID.
Okay, let's talk a little bit about vaccinations. Vaccinations are safe and effective at preventing COVID-19. As of February 7th of 2022, over 212 million individuals in the United States have been fully vaccinated. That's about 64% of the population. Vaccine effectiveness studies have shown that COVID-19 vaccines reduce the risk of COVID-19 transmission, as well as the risk of serious illness, hospitalization, and death. You can find your employer's COVID vaccine policy in the CPP, and your employer is going to provide you with more information on how to access the COVID vaccine in your area. One of the things that you should be aware of is that symptoms of COVID-19 sometimes appear and sometimes do not. If you have COVID-19 and have symptoms, they may present as fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. This is not a list of all of the possible symptoms. You may have others. If you do show any symptoms, do not come to work. Instead, what you should do is get tested. So let's talk for a minute about COVID-19 testing. Your employer is required to make COVID-19 testing available to you at no cost during paid time. Your employer might do that by providing testing on site at the work site. The employer may also do that by sending you to off-site testing facilities where you can be tested for no cost to you, or by providing home test kits which you will administer yourself. We'll talk in a minute about how to administer those, but just be aware that if you are having to go to an off-site facility for COVID testing, your employer will pay you both for the time in going to get the test as well as your transportation. If you do have COVID-19 symptoms and are not fully vaccinated, you will need to get tested. Additionally, if you have a close contact with somebody who has COVID-19 in the workplace, your employer will provide for you to be tested unless you are both symptom-free and recently recovered from COVID-19. Your employer will also provide for you to be tested if you're exposed to COVID-19 during a workplace outbreak. Depending on the magnitude of that outbreak, your employer may provide for testing once or twice per week. However, if you are symptom-free and recently recovered from COVID-19, you will not need to be tested. You may also be tested in order to enable you to keep working or return to work sooner if you would otherwise be excluded because of a COVID-19 exposure. You can do that type of testing in accordance with CDHP guidelines. Let's talk a little bit about the definitions from the situations we just talked about. Close contact. Your employer will provide for testing if you have close contact with a COVID case at work. Close contact means within 6 feet of the individual for a total of 15 minutes during a 24-hour period. The 15 minutes do not have to be consecutive. So if you're near that COVID case for 10 minutes at the beginning of your shift and 5 minutes at the end, that does meet the 15-minute requirement. However, this 15 minutes also needs to be during the high-risk exposure period in order for your employer to provide testing. The high-risk exposure period varies for different COVID cases. If someone is symptomatic, their high-risk exposure period is from 2 days before until 10 days after the onset of their symptoms. If they're asymptomatic, that means they're not exhibiting any COVID symptoms, then the high-risk exposure period is from 2 days before until 10 days after the individual gave the specimen for the COVID test that showed they were positive for COVID. So again, for a close contact, if you're around somebody within 6 feet for 15 minutes during a 24-hour period that overlaps with the individual's high-risk exposure period, your employer will provide testing unless you're symptom-free and recently recovered. What does recently recovered mean? Recently recovered in these situations means recovered from COVID-19 in the last 90 days. Your employer will also provide for testing if you are exposed to COVID-19 during an outbreak at the workplace. An outbreak is defined as 3 or more COVID cases among employees in the exposed group during a 14-day period. Of course, there's the same exception in this situation, which is that testing will not be provided if you were either absent during the exposure or you are symptom-free and recently recovered from COVID-19. So when your employer provides one of these tests, the employer does have to meet certain requirements. The test has to be one that is approved by or has emergency use authorization from the FDA, and that test has to be administered in accordance with its approval. You are required to use a test that tests for current COVID-19 infections, which means you can use a PCR or an antigen test. You cannot rely on an antibody test for this testing requirement. Finally, the test cannot be both self-administered and self-read. That means if it's a take-home kit, for example, that you cannot give yourself the test and also read your own results or monitor your own results. Instead, the employer will need to provide some type of monitoring, either through a telehealth facility or perhaps by having another employee actually do the monitoring over a video conference. There'll have to be another person observing the results for that test to be valid. And so, if you are positive for COVID-19 or you're excluded from the workplace because you've been exposed, you are eligible for certain wages and benefits. If you have been assigned to telework after you've been exposed to COVID-19 or when you have COVID-19 yourself, you're not eligible for this, what we call exclusion pay, because you're able to continue to work remotely. You're also not eligible for this exclusion pay if you receive any disability payments or workers' compensation temporary disability payments for the same underlying reason. So, for example, if you are out with COVID-19 and you receive temporary disability, you cannot also receive exclusion pay at the same time. If you are excluded because of a workplace exposure to COVID-19 or a positive test, your employer is required under the ETS to maintain your earnings and wages, your pay schedule, your seniority and job status, and your other rights and benefits as an employee. Typically, exclusion pay lasts between 5 and 10 days. For longer exclusions, you may be eligible for temporary disability or disability instead of exclusion pay. Wages that are due to you must be paid at your regular rate of pay and no later than the regular pay date during your exclusion period. Finally, you should be aware that you might be eligible for additional wages and benefits either under workers' compensation, local governmental requirements, your employer's own policies, or other leave that's guaranteed to you by contract or collective bargaining agreement. There are some exceptions to exclusion pay. Exclusion pay does not apply if the employer demonstrates that the close contact that led to you being excluded from the workplace was not a work-related contact. So, for example, if you're exposed to COVID-19 at your child's school, or if you're exposed because you are a caretaker for someone in your household who has COVID-19, that is not an eligible situation for exclusion pay. However, you may be eligible for other leave such as sick leave, paid family leave, unemployment insurance benefits, etc. Your employer may require that you use paid sick leave that it provides that is separate than the paid sick leave that's mandated by California's paid sick leave law. So if your employer is providing more than the minimum requirements, the employer may require you to first use that sick leave. You should be aware that recently the California legislature passed into law an extension of the COVID-19 supplemental paid sick leave. That means that you may be eligible for additional benefits through that law while it's still in effect. Finally, be aware that exclusion pay does not apply if you're receiving any disability payments or covered by workers' compensation or temporary disability for the case. And if your employer determines that exclusion pay does not apply to you, that there's an exception, your employer is required to inform you of that exception so that you're aware of whether or not you're going to be receiving exclusion pay. If you have any further questions about these things, you should talk with your human resources representative.